I am privileged to be joined by Megan Maack, who is the Chief Executive Officer and founder of Childhood Dementia Initiative. Back when Connor was diagnosed in 2019, one of the first things I did was Googled Sanfilippo syndrome, and a segment from 60 Minutes Australia popped up, and it was about Megan and her children, with their story about her two children trying to get into a clinical trial along with the O'Neill family in the United States, and taught me a lot about just sort of that parent-led fight in Sanfilippo world to save our kids' lives. So Megan, first of all, thanks for joining me. And I would like to start by asking you to tell us about your background. I know you're in Australia, and not only do you work currently at this Childhood Dementia Initiative, but you also were founder and CEO of the Sanfilippo Children's Foundation. Let's rewind a little bit and tell me about yourself, and we'll dig into it from there.
Sure. I was just a regular mum, had a couple of kids. I was working. I was a management consultant by background and doing the whole juggle thing. My kids were born really close together, just under 2 years between them. When they were aged 2 and 4, they were both diagnosed with Sanfilippo syndrome. And it was a very, the pathway to diagnosis was not as drawn out as other families tell us, but I was onto it. So Ida had started to show some slowing in her development at about the age of 2, and around the time that Jude was born, and we eventually got a diagnosis for her when she was 4. And at that stage, she had some mild developmental delays, a little bit of a speech delay, global developmental delay, but very mild. And Jude was a perfectly developing 2-year-old that we tested because we knew genetically there was a 1 in 4 chance that he would also have Sanfilippo, and he did. And so I, at that stage, like all parents who've been through something like this, was just completely floored, grief-stricken. And I won't even, try to describe what that was like. But I decided that I wanted to direct my grief into something that would, make a difference and build a legacy for them. I understood that their life expectancy was reasonably short, and that it was made very clear to me that, they wouldn't get treatment in their lifetime. I think one of the doctors had said to me, don't go chasing around the world looking for a cure. It's not going to happen. So initially I was like wanting to put my grief into something positive to build their legacies so that their lives weren't lived in vain. If they were going to live these short, painful lives, I didn't want them to have been for nothing and for another family to have to go through this. So I started to connect in with other families, and I actually connected with Glenn O'Neill very early on because Eliza was diagnosed, I think, in between Isla and Jude. So Isla was diagnosed in May 2013, and then Jude was July 2013. I think Eliza might have been in the middle. So we were both newly diagnosed parents, and we connected. And I started the Sanfilippo Children's Foundation around the same time the O'Neills started the Cure Sanfilippo Foundation, and we have always collaborated and always shared knowledge, skills, experience, the whole thing. So, long story short, I ran the Sanfilippo Children's Foundation for 7 years, and in that time we raised around, I think it was $8 million that we put into research. Some of that came from the Australian government for some research projects. Some of it came from general philanthropy. We were involved in investment in Abiona, as many of the Sanfilippo organisations were, which became, had an actual financial return on investment, which we were able to then back into the work of the foundation.
How did that collaboration come about, Megan? Because I have heard the Abiona story from others. And how many different players were involved with that, like internationally?
Oh gosh, it was so many years ago. We actually made a little video on it, I'll find and share with you if you're interested, just talking about how we went about that. I think there were about between 8 and 10 foundations around the world, and we invested different amounts into that. And at that stage, it was a private company. We were given Series A holdings. And then when Abiona were acquired by, I think they were called Plasmatech, but they rebranded to Abiona when they acquired Abiona, our holdings converted to a NASDAQ listing, and we then received shares that we eventually traded. And that was a whole process for us in Australia. Being able to actually trade those shares took a long time, but we did. And that was a huge windfall, and something I've always reflected on as a model for philanthropic investment moving forward. Because, I mean, venture philanthropy, if anybody is going to be making money from the development of drugs, why not be the patient organisations who are going to then plough it back into programs for the patients that directly benefit? So I love that as a model, and I'm interested in sort of exploring that further. But over the years I was running Sanfilippo, we had contributed quite a lot to the field of research for Sanfilippo. And, I came to know a lot of people in the research space, a lot of people in the care space, a lot of people in the, parent advocacy space. And I noticed that there was this real fragmentation in how we research. This all began with research, because Sanfilippo Children's Foundation was all about research. There's this real fragmentation in how we research these rare diseases. We had received funding from the government. It was about $2.5 million, I think, Australian dollars, to develop neuronal cell models. We call it the brain in a dish, where we took cells, skin cells from children, and the researchers re-engineered them into brain cells, and then we did high throughput drug screening to see if we could identify drugs that would work. And I remember looking at this model and going, this is brilliant. I'm really excited that we have this for Sanfilippo, but why couldn't we do this for all of these other diseases? If we're going to invest all of this money in the infrastructure for Sanfilippo, could we not leverage that infrastructure across other diseases? So I was sort of thinking about that. And I'd always thought about, rare disease is an interesting space. Like, I get the idea of economies of scale and bringing things together to have greater impact and leverage. But just being rare isn't enough. There has to be other commonalities. And I noticed in the academic literature that a lot of these conditions, occasionally, not always, but occasionally, were referred to as childhood dementia. Sanfilippo, Batten disease, Niemann-Pick-C, Tay-Sachs, there was a whole range of these diseases that in the academic literature were childhood dementia, but we weren't using that language in the mainstream. We weren't using that language in the clinic. So that was kind of picking around my head. And then as a mum, it's different around the world, but I think around the world, we all have, very similar challenges. Accessing the care and support that I needed for my kids was just this huge, huge battle. And, I am the privileged, white, educated, middle-class woman, and I found it hard, to get what my kids needed. How the hell, in a country like ours that has, free healthcare and, really good social care and all of these wonderful things, how is anybody else doing it? So I started to sort of think about that, and just kept
Megan,
coming back to
what was the main resource you did have in Australia at the time? Was it like an MPS society, or was there a Sanfilippo Foundation?
Oh, when I started Sanfilippo Children's Foundation, there was an MTS society here in Australia. I think they still exist, but they're going through a period of change at the moment, so I can't really talk on their behalf. But there wasn't a Sanfilippo organisation. And that was actually a really important point, because I didn't want, I knew that in order, and Sanfilippo, of all of the MPS disorders, I want to say it's up there. It's one of the worst, right? The cognitive involvement and the fact that we have no treatments. So the challenges for the Sanfilippo community amongst the MPS disorders are very different. So I kind of didn't want to just put my energy into fundraising for the MPS Society. I really wanted to drive research, and I wanted it to be specifically for Sanfilippo. So that was the kind of background there. But then I was like, okay, so thinking about these conditions, and we think about a lot of disease groups naturally as collectives, like cancer. And I come back to this all the time. So you don't hear people out there going, oh, my kid has osteosarcoma, or my kid has neuroblastoma. My kid has cancer, right? There's a cancer center set up down the road that will help us, will address our needs. We think about cancer as a collective, and childhood cancer as a collective, and we address the needs of families as a collective because they're common. Why are we not doing this for childhood dementia? I mean, my challenges as a mum with kids with Sanfilippo and your challenges as a mum with kids with Batten's disease, they're really similar, and we need the same doctors, looking across both, looking at the commonalities. So then I was like, okay, so this term childhood dementia had been defined in the academic literature. How many kids are we talking about? How many conditions? What's the kind of impact? And that wasn't quantified anywhere. The impact wasn't quantified anywhere. So the first thing we did was we engaged a health economist and some academics, and we got them to go out and really pull together, and I can talk through the process that they did it, but quantify. And what they came back with, I think, shocked everybody. I don't think that anybody expected it to be as prevalent or as impactful as it was. So the stats that came out of our initial burden of disease study, and we have redone it and are preparing to publish it academically. So the numbers will change slightly, but not dramatically. But at the moment, the numbers are, incidence is 1 in 2,800. So 1 in 2,800 has children are born with a condition that will lead to dementia in childhood. Right? And the definition of dementia is a period of time of normal development, plateau, regression. And some children, Tay-Sachs, for example, very, very rapid, acute first couple of years of life. They'll do the whole trajectory. Others, we have a girl, we work with her family here in Australia with Lafora disease. She presented when she was 15, but the trajectory is the same. A period of normal development, a plateau, and then a regression. So 1 in 2,800 babies are born with this, more than cystic fibrosis. Around the world, we estimate there's probably around 700,000 kids living with dementia. And the really shocking statistic that came out of that gets everybody is the death rate. So the death rate of kids with dementia is comparable to the death rate of kids with cancer. Right? So you look at that and you think, okay, well, sure, more kids get cancer, but we as a community and a society have accepted that as a collective problem, and we've invested in it, and we've moved the dial so that we have better diagnosis, we have better treatments, kids are living longer, all of those things. But we can compare these conditions on the death rate. We can compare the incidence with cystic fibrosis. So once we had those kind of figures, for me, and I describe it as, once we uncovered the impact of childhood dementia, we couldn't ignore it anymore. So I started the Childhood Dementia Initiative in 2020, and everybody remembers what was going on in 2020, not the best time to start a new organisation, but we knew we couldn't wait, and we needed to get on and get this moving. So we've been going now 2.5 years, and basically our focus, our end goal is to change the outcomes for children with dementia and their families so that they have treatments and cures, equitable access to quality healthcare, and to be a health policy priority. And we're focusing on 3 areas: research, but we're not funding research because we're never going to be able to bring enough money in to really drive or to move the needle ourselves. But we think where we can have greater impact is through enabling, facilitating, and advocating. So we will bring together the researchers. We will advocate to major funders like philanthropy or government to release funds for this research. We will encourage and provide data and evidence for researchers to say it makes sense to study these conditions as a collective, and we will empower and enable them to do that. In the care space, we really need to understand, well, what are the care needs of families? How are they being met? How are they not being met? What needs to change so that families receive the care and the support that they need? And the really kind of big focus that underpins all of this is advocacy. What are the policies that need to change to ensure that these kids are no longer discriminated against? And really, when you look at what's happening in our health system, certainly here in Australia, but I would be very surprised that when we go out internationally, if it's any different. But here in Australia, if you're a child with a dementia condition, you're lost in a rare disease silo in a health system. You don't have anybody doing central care coordination. You don't have anybody, you don't have consistent care pathways. Depending on where you live and the condition you have, the treatment that you receive is different. So we're really looking at systems change for long-term impact and outcomes for these kids. And it's a hard thing to do, but I think it's the right thing to do. And so, to boil it right down, it's very different to anything that we did with Sanfilippo, and it's very different to anything I've seen anybody else doing anywhere in the world. And I will say, I think it is very innovative. We're basically doing a very simple thing. We're changing the language and the discourse around these conditions. We're bringing them together as a collective, and if we can successfully do that, the rest will follow. What we're doing is we're saying at the top level, the things that we all have in common that we can influence in our systems is the area that we're focused on. So, for example, here in Australia, last year we advocated to government and we got government to release, it wasn't very much from a research perspective, but $3 million for a research course specifically for childhood dementia. So it's like that, that saying, the rising tide lifts all ships. It's about raising the profile of childhood dementia that will benefit all of these communities and organisations who are doing this wonderful work. We're trying to put the focus and the spotlight and the need for funding and the need for change so that these organisations can do their wonderful work. And at the same time, we're trying to, bring consistency across all of them from a systems perspective. So yeah, we're not looking at replacing any organisations at all. We're very symbiotic.
Talk a little about your professional background and how that has played in and impacted your ability to start up and, run some of these organizations you've been a big part of. Because that's something I found myself in. Right when you get that diagnosis, you're kind of in that, what am I made of? Where do I go
Yeah.
from here? What do I even know how to do?
Yeah.
And can you talk a little about that?
Totally. Yeah, I know exactly what you mean. I remember when the kids were diagnosed, just feeling like, oh my God, I've wasted my life. Like, what the hell was I doing in corporate? Why didn't I study medicine? Or, I didn't even listen in biology. I had no interest. Like, where to now? And it took me a little while to realize, actually, that's a real superpower, because well, for two reasons. One, I did have that business background. I had an MBA. I knew how to, change. I knew how to run big programs and drive change, and in a very different environment. So I knew how to do that and knew how to run a business, which was important for the foundation. But I think my superpower was the stupid question, and no one expected me to know the answers to things, or I just went about it as, if I'm talking to a scientist and I don't understand what they say, I'm gonna just keep asking until I understand. And if something is done a certain way that doesn't make sense to me, I'm going to question that. And so the power of the stupid question, I think, has really been the thing that has driven me and allowed me to achieve what I have today. And the biggest stupid question is, why are we looking at all of these rare diseases in isolation? Why aren't we looking at them as a collective, like we do with cancer, like we do with cerebral palsy, like we do with adult dementia? Like that's the power of the stupid question, because all the people who are working within the system are working within the system. So yeah, I think one of the things I'm often dismayed at is there are so many amazing people working in the rare disease space, so many smart, resourceful, energetic people. But unfortunately, a lot of them had to go through this diagnosis to get there. And wouldn't it be amazing if we lived in a world, and I'm kind of off-piste a little bit here, but wouldn't it be amazing if we lived in a world where the bright minds, wanted to come and solve the problem of rare disease, wanted to come and be in here and didn't have to get shoved in like you and I did through a diagnosis. But, that's reality.
Sanfilippo Children's Foundation talks about 3 research focus areas: halting the disease progression, repairing damage, and improving quality of life. I'd like to hear from you where you've seen sort of the most strides over the years in those, and where you see the future pretty bright or not bright in some of these areas.
Yeah. So the strategy of Sanfilippo Children's Foundation was always those 3 things: halting disease progression, repairing damage, and improving quality of life. And the approach that we took was, every year we would do a competitive call, go out to the researchers and say, give us your applications for funding for research projects that fit one of these 3 categories. And almost 100%. There may have been 1 or 2 that were in the improving quality of life, but most of them came into the halting disease progression. And that is where most of the kind of research we funded for Sanfilippo was done. Now, Sanfilippo Children's Foundation, I don't want to speak on their behalf, because we do have a CEO who's wonderful and who's running that now, and she's working very closely with a number of international Sanfilippo organisations. But last year they published the roadmap, and this is a project that I started working on before I started the Childhood Dementia Initiative, which is basically interviewing researchers, pharmaceutical companies, families, anybody involved in the process of therapeutic development for Sanfilippo, to understand where are the barriers to therapeutic outcomes and what is the best use of the limited funds that we have in order to get us there. And I think the reason we did this was, it was great that we were funding this research where the researchers came up with an idea, but at the end of the day, there are barriers to getting therapeutics developed that an individual researcher is never going to come to you for funding. For example, data, or patient registries, or biobanks, or regulatory processes. So these are the big kind of pieces of infrastructure, or pieces of policy, or pieces of activity that need to happen in the research space. But a researcher is never going to go, hey, we need a biobank of tissue samples that's globally connected. So the research roadmap that was released last year is looking at, well, what are the really key things? What is the pathway to therapeutic development, and how can we be more targeted in how we're investing in the research process for Sanfilippo? So at the moment, and there'll be more of this coming out from the Sanfilippo Children's Foundation about how the strategy will change to really drive that roadmap. But it is something that we worked on with Cure Sanfilippo and a number of other organisations around the world. I mean, halting disease is important, reversing disease is important, quality of life is important. Avoiding is important. Or I can't see how necessarily any of those pieces are less important than the others. And I think one of the things that's interesting is, as a parent, and I'm sure lots of other families who run organisations feel this as well, your focus will change over the life of your child as well. It's really about how do I improve the quality of life and make this child as comfortable as they can possibly be.
We talked a little about when a parent is thrust into that situation of trying to pitch in or trying to figure out where they might be able to add some value or pitch in for the cause. What pieces of advice would you have for, say, new parents recently diagnosed, looking for answers and looking for ways to pitch in? I've learned the longer you go with this diagnosis, with Connor, you start out, I'm going to go find a cure. I'm gonna be part of this incredible movement, but then you also see along the way, like, wow, this is a long, dangerous, scary road with so much uncertainty. And then along the way, you start thinking a lot more about legacy. And I never thought about legacy before, but now it's kind of like leaving a beacon of light for my kid in the community. And also, we have an opportunity as parents and family members to leave a legacy and create a legacy for ourselves as well. And I think that's a real gift in a lot of ways. And I'm curious to hear, from your perspective, like, what is some advice you might have for people new in a diagnosis trying to find their way and find where they can go?
Oh my gosh. We could talk about this for hours, right? I think for me, legacy is a huge thing and it always has been. So, I mean, I think I really started Sanfilippo Children's Foundation not expecting that my kids would ever get treatment. And as it transpired, one of them did. One of them participated on a gene therapy clinical trial. The other one did not. He had an immune response, so he had antibodies. My daughter received the gene therapy, but she was, as we now understand, outside the therapeutic window. So she was 8 years and 8 months. And now we know they're looking at 36 months and below. I think, you mentioned earlier about it's a long road. And we used to always talk about this is a marathon, not a sprint. And it's really difficult at initial diagnosis where you have that, surge of adrenaline and desperation, and you want to throw everything in. I mean, you can't really temper that. But I would say there are a lot of amazing people in this community doing amazing things. The first piece of advice I would give was find someone and align with them unless you absolutely need to. And this was advice that was given to me. Unless you absolutely need to, don't start another organisation. I did start another organisation because there wasn't one here already. And I'm very, very pleased that I did, but don't immediately start another organisation. Join the Cure Sanfilippo or the Beyond Baton or whoever the organisation is that you feel best aligns with your objectives. We talk about self-care. I roll my eyes when I say that because we have to look after ourselves, but everybody will say, oh, take care of yourself. How do you actually do that? Like when you have kids with these conditions, how do you actually do that? But it is a long haul. And, you kind of redefine your life goals, right? What hopes I had for my kids 10 years ago, 5 years ago, today are very, very different. And I guess even the smallest of changes that we deliver, and we have delivered, we have to celebrate, we have to acknowledge, we have to, keep as their legacy. I don't know, I'm rambling. It's so hard. It is a soul-destroying life and nobody comes out unscathed. I talk about, I lost my career, I lost my marriage, I lost, my financial stability, everything. But at the end of the day, that's nothing compared to what my kids are losing.
The isolation and loneliness and even depression across family, that's a real big deal. And even just opening that communication and talking and finding new ways to allow others to tell their stories too, because telling your story and having it out there just makes your life easier. It makes your kids' life better, and it makes the community more able to pull in.
And you're absolutely right that finding your tribe, and that's one of the things I love about this childhood dementia approach is Sanfilippo, we're incredibly isolated. It's very rare. It's hard to find other families who are going through the same thing as you, but at least we do have a community. At least there are thousands of us in the world. There are people out there going through this, and their child has a very similar condition to mine, but because their genetic cause is something ultra rare, they don't actually have a community. They don't have anybody representing them. And so being able to kind of provide them with a tribe, I think, is hugely powerful. Yeah. And it's not exactly the same, because your kid might have something that has a different name to my kid's condition, but the challenges and the things that we face and the support that we need and the dreams that we have are all the same. When my kids were first diagnosed, all I could think about is, oh my God, they're going to die. And when I tell people about their condition, all I think about is, oh my God, your kids are going to die. But now, 10 years in, actually, I can't tell you, that's not the worst. The worst is that we have slowly lost them every day. Like grief, bereavement, that begins at diagnosis. And the little girl who I had at 4 years old, who, was sassy and cheeky and funny, she's gone. And I lost her, and there's no ceremony, there's no ritual, there's no acknowledgement of my community outside of Sanfilippo or rare disease or childhood dementia, who understands that every single day for me is grief. And I had a friend who lost her daughter to Battens, and I remember being at the funeral, and she whispered in my ear something like, "This is awesome. Everybody understands my grief today," and we have a very dark sense of humor. But what she meant was, like, I've been doing this for 10 years and nobody understood that I've been doing this. And today they're hugging me and, Anyway, sorry, I digress.
This idea of losing your child a little bit every day is just terrifying to every parent. So any parent that actually starts to understand what's going on sees this as being important and as a common cause that they can get behind because they're there. I wanted to ask you now, I know in Australia, you have the free healthcare, but at the same time, you don't necessarily have as many specialty items or specialty areas for that. Yeah. Do you guys have a common Ronald McDonald organization or a Shriners or
we have
support pediatric care?
Yeah, we have, well, interesting, right? So we have Ronald McDonald House, which provides accommodation for families when their child's in hospital. But, guess what? A lot of Sanfilippo kids don't spend much time in hospital because there's no treatment, right? So we recently released a report, which I'll send you, but which was done by a consultancy here called the Nous Group. And the kind of subtext of it was, we don't fit. So if we had children who had a static disability, there's a whole bunch of stuff set up. People understand static disability, If we had a child with autism, people understand that. The pediatric system understands that. If we had a child with cancer, the systems are all set up in place. We're lost because we've never had a voice to advocate for our needs as a collective group. So let me give you an example. Here in Australia, we have hospice care that provides end-of-life care, but also provides respite services for families and support for families of a child who has a life-limiting condition. My children can't access our local hospice care because they have a behavioural issue. And the hospice care is not resourced to take kids with a behavioural issue because it was built around kids with cancer or kids with heart conditions or kids with, other physical, problems. But if you think about it, you read in the adult dementia in the adult dementia world, you hear them talk constantly about the behavioural and psychological symptoms of dementia. BPSD, it's got an acronym. My kids have dementia. They have BPSD. That's a symptom. This hospice will not take them because of a symptom of their condition for which they need the service in the first place. So it's like saying to a kid with cancer, you can't come in here because you haven't got any hair. So there is a huge systemic discrimination against our children, not intentional discrimination, but it's there because we've never been able to articulate the need in a way that systems can understand it and at a magnitude that they can understand it. Because, of course, the system's never going to come to Sanfilippo and say, tell us about your needs, because we have 100 kids in Australia with Sanfilippo. But, come to us because we're representing a whole community and we can tell you the needs of our community because they're common. I don't remember what you asked me. I went off on a tangent.
No, that's okay. That's great. Let me ask you another one then, because you talked a lot about education for different cohorts of individual groups. So, much like Mike's question about if you had dollars to apply to these different stages of therapeutic treatment. Let me
Yeah.
ask the same question. If you had it to apply to education, be more concerned about educating the parents in terms of what they need for the resources for their families, their caregivers in terms of both the GPs for early screening and the specialists for the care ongoing, or call it society or call it policymakers so that we can put a face on it. Policymakers to teach them how they need to change the system or fund research projects from a governmental level. Like where do you want to focus?
I don't think we necessarily need to educate the families on what their kid needs. They know what their kid needs. We need to give the families a voice to be able to articulate what their family needs in order that the systems can accommodate them. And we need to give the families support and guidance and frameworks and really move them through the system. So that's what I think families need. I don't think the families need education. I think we need systems that support them so they don't have to be educated on how to navigate a broken system. Where we're putting our energy in education is educating health professionals. So we've developed a suite of training materials which we're rolling out to any health professional, whether they are a neurologist or a pediatrician or an allied health professional or a nurse or anybody that deals with these children, around the challenges that families face, what we really need from our health professionals. It's really interesting. Everything we do is based on evidence and the lived experience. So everything we do, we consult families, and every time we consult a family, we will publish. So we'll never ask a family to contribute to a consultation that we don't then publish. It's about amplification of voice. We asked families, what do you want from your health professional? And the number one thing they came back with, we came up with a list of, I think it was 7, but the number one thing they asked for was respect and understanding from their health professional. I mean, that's outrageous. That says to me they're not getting that. And so for us, it's about educating the professionals who are working with them.
What has been your feedback from those professionals that you have been connected with thus far? Like if you have provided resources to them, do you find them to be, like, do you have to carry them across the goal line, so to speak, yourself, or are they seeking those resources to self-educate?
Some we do, but most, and I mean, this is the thing, we haven't reached them all, right? We go out to conferences, we do in-services, we do as much as we can. We identify where there are champions. We amplify the voice of those champions, neurologists or pediatricians who are already working as, with this collective view. We've been overwhelmingly supported by health professionals in Australia who we've engaged with on this. And I think they can see the real value, because the thing is, like, it's all well and good for me as a parent to go, oh, my health professional, blah, 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 blah. But these are human beings, right? These are human beings who are delivering incredibly difficult messages, and they're trained to fix, they're trained to cure. And in our kids' case, there's no fix, there's no cure yet. So for them, this is the pointy end of pediatrics. This is the hardest clinical activity that these doctors will ever do, and they're humans. So, one of the things I'm interested in is understanding what is the, environment for them, and how are they, A, trained, B, supported, all of those things. So I think that's critically important, and that's where we're certainly putting a lot of our energy at the moment. We're building a community of practice around people who provide care for children with dementia, so that they can have kind of peer interactions, and we facilitate that as a way of kind of broadening education. But I think education of policymakers is equally important.
One of the doctors, especially your pediatricians, your pediatric specialists, they care very much about their populations, or else they wouldn't have been into this job in the first place. So getting the early leaning in advocates for that group, you can at least get some key opinion leaders and some champions for your topic. Do you find that you can do the same thing with policymakers, or is there a wall there of understanding that you need to broach? Or is it enough to come at it from the parent advocacy side, as so many organizations do? What
I've found, and I've done a lot of advocacy here in Australia, over 10 years, they are much more open to listening and engaging with me with my childhood dementia hat on, because it's easier for them. I'm representing 70 plus conditions. They don't have to deal with 70 plus people. And they also understand dementia and the challenges that adults with dementia have. And so it's not a very big jump for them to then go, okay, I understand the challenges that your family are having. Whereas I used to go to these politicians and try and explain Sanfilippo, and I had some success, but it's harder for them to get. So I think that commonality, the grouping together, it makes it simpler for them. And we've been really well received within the amongst policymakers at the federal level here in Australia. We're starting to do so we have a weird government system where we've, similar to yours, I think, but not exactly, where health is at the state level, but policy is at the federal level. So we need to influence federal before we can really influence state. But we've had good support from them. We've had some funding from them for the health professional education. We have some new funding that will come through later this year for a new project. So I feel like we've had much better progress as this kind of collective, and going to them with solutions as well, like going to them to say, and I'm holding up analysis to say, we've done an analysis of all of the funding that you've given to cancer over the last 5 years, and I'm comparing that to the funding that you've given to the childhood dementia disorders over the same period, because the death rate is the same and the disparity is outrageous. So I'm just looking at what it is. One of them is like 20 times the amount of funding went into cancer as childhood dementia, and that's just the kind of public money. That's not even philanthropic money. But yet the same number of children die, and families live longer with it and suffer more with it. So I think they understand that. They love the stories, of course. If you're going to a policymaker, go with a story. They love the stories. But I think they understand when you're going to them with this is a problem, and this is, how you can help provide a solution.
Speaking of your comment earlier, that's definitely one of those times when go ahead, try to make them cry. Because that's what the politicians definitely understand. Your policymakers, make them cry and go to it. I don't care how much you make them cry. Do it. Given the power of aggregation in terms of accessing those policymakers and financing, have you found it easy to make common cause with adult onset dementia, or are the populations and needs just too differentiated there?
No.
Common cause.
No, so what's super interesting, so internationally, every country has an Alzheimer's organisation. Traditionally, they've been called Alzheimer's organisations. I think the American one still is. The Australian one rebranded about 5 years ago to be Dementia Australia. So they're very clear that they represent all people with dementia. And probably about 4 years ago, before I started Childhood Dementia Initiative, I approached their chair, and I was lucky enough to get a meeting with him, and I explained to him Sanfilippo and it's a dementia, and he was like, I didn't know children could get dementia, and I'm the chair of Dementia Australia. This is outrageous. And I was really expecting them to push back, and they haven't. And so we've continued to work with them. We do joint advocacy with them. They're a big organisation, quite slow moving. So that's going to take some time, but we're moving forward with that. We're also working with one of the other major peak bodies here who provide a lot of support services, and they extended their services to families for behavioural support for families with, a child with dementia. And I've accessed those services, and they were brilliant. So there's definitely an opportunity to look at these kids through, we call it looking through the dementia lens. Health professionals have adapted their clinical practice thinking about my kids having dementia, because a lot of these paediatric specialists know intellectual disability or autism, and the triggers for behaviours and the triggers for certain things that our kids demonstrate are completely different, and they're far more aligned to adults with dementia because the regression is the same. What is really interesting is last year I was able to travel to Europe, and I was fortunate enough to meet with the CEO of Alzheimer's Disease International, which is the peak body for all dementia organisations globally. And I had a really interesting conversation with her. And one of their big challenges in the dementia space is systemic discrimination around ageism, right? So even the World Health Organization, who represent, all of the health, they fall into the non-communicable diseases topic area. They often neglect to mention dementia because that's just an old person's disease. So the CEO of Alzheimer's Disease International was very interested in, well, this is a really good angle, because no longer is dementia an old person's disease. We've always known there's been an early onset, but now we have children. This is a lifespan disease, and that changes the way everybody thinks about dementia. So I've actually been really overwhelmingly supported by the adult dementia spaces. Of course, there are a lot of things that are different, particularly the cause, because our cause is all genetic. But in a lot of ways, the fact that we know the cause of our kids' condition means, from a research perspective, they're good disease models for testing drugs and things. So that getting that collaboration between adults and children researchers is another area that we're focused on. Sorry, I'm talking a lot.
No,
you put
this is
something?
great. You know,
Yeah.
speaking on the education piece, I found that to be huge in our community. I know that there are a few different foundations in the Sanfilippo world that have worked together to create almost like learning guides about Sanfilippo, stuff you can
Yeah.
bring to a school, to a community, and kind of teach them and all that. It sounds, first of all, it seems like an obvious place for collaboration across different foundations and everything, because a lot of that information is going to be the same, except different countries might have different things and
Yeah.
all that. Do you guys find yourself, when you work on the education stuff, do you have any like real key partners that are helping you with that? How collaborative is it? Or are you guys doing a lot of that grunt work
The
yourself?
patient orgs, do you mean, or
Yeah, with the other patient group.
Yeah, we have set up a forum here in Australia of patient orgs who represent kids with these conditions. So Sanfilippo Children's Foundation, Mido Foundation, a big component of the kids who have dementia is caused by mitochondrial disease, Batten disease, Tay-Sachs, there's a whole range of them. We were meeting on a quarterly basis because we wanted to use that forum as an opportunity to kind of build the capacity across the whole sector. So we're kind of looking at the moment as what's the best way for us to work together. But I mean, we 100%, that's how I'm thinking we will start to look internationally, is where are the patient organisations that we can start to talk to around this? How can we bring them together, and how can we do joint advocacy and that kind of thing? And the individual patients. So we've set up a patient advocacy program, and we've got about 60 families here in Australia who are actively involved in either, contributing to consultations or joining us for media or meetings with politicians or whatever it might be. And a lot of those are, the leaders of patient organisations who are also parents. So we're trying to, build that collaboration. We hope that we're not threatening to anybody. That's certainly not our intention, that we're not talking about getting a bigger piece of the fundraising pie. We're talking about growing the pie for the whole community. I've been meaning to think about, okay, how am I going to go out and engage internationally with patient organisations? And if I put out an ask that if you represent a community that has a condition that presents with dementia in childhood, we would love to hear from you. I suppose my concern is I might be overwhelmed and I'm not yet ready to kind of respond to all of that. But that would be my ask. If you run a patient organisation or are a parent of a child with a condition that is childhood dementia, we would love to hear from you. And if you're not sure what those conditions are, there's 70 plus. We have them on our website.
What's the website address for your initiative?
childhooddementia.org.
Great.
Yep. And I'm Meg at childhooddementia.org.